coming out very significantly, which is correcting around 841 million. We have some other streams like market dues with very true correction. We have beach fee services, very true correction. So what is the safety story about this board?
Okay.
If you delete, if you are not considering any of the sector, I mean, do other streams are almost like there's nothing being corrected from those other streams.
Fine. The question, the last one by Senator Cherargei on systems, because it's a substantive audit issue, we can deal with it by referring to the audit report. But maybe just go back to the issues raised by the senators, and maybe we sound cynical because we are not used to success stories within the public finance space. The PBO is telling us that your revenue potential is 1 billion. You have exceeded it. I mean, it is a kind of, we should be congratulating you, but you need to prove to us those numbers. Your revenue potential is 1 billion, but you had a budget of 2.3 billion. That also brings to doubt the projections from the CRA, because if Homa Bay can project 2.3B and they are doing 1.2B, unless those projections exclude hospital fees, because there is a conversation around hospital fees, whether they should be here, and yet you've got facility improvement financing, which should segregate the numbers. But Governor, you may respond. We are happy to listen to a success story.
Thank you very much, Chairman, and I thank the senators for their questions. So Senator Sifuna said if we remove the health sector revenues, will our revenue model collapse? So first I'd like to state that when we came to Homa Bay in 2022-23, our revenue, inclusive of the health sector revenue, was 300, was it 200? Yeah, it was 234 million, which means that...
Which financial year is that?
That was 2019-20 or 2021-22. 2021-22. So starting from that point, inclusive of the revenue generated from healthcare, we wanted to see how to consolidate our revenue. The revenue...
Accuracy. Just on accuracy, Governor.
Yeah.
I thought the report has been done by Were. Why don't the Governor quote the exact figure, and it is here. This is on receiver of revenue 21-22. This is your receiver of revenue statements for financial year 20, but you have given analysis of 21-22.
How much was it?
How much?
311,995,474. 21-22.
Okay.
And then in 22-23 is 859,454,023. And now in 2023-2024 is 1.2 billion 495,830.
Thank you.
Yeah, but it demonstrates what you're saying.
So I think the point I was trying to make there is that inclusive of the healthcare revenue, the revenue was still performing very, very low. So one of the things we had to do within our facilities is to see also how do we consolidate the revenue, because this revenue goes back to provide healthcare to the people. So so in the first place, our revenue improvement plan had to include our health sector revenue, because we felt there was also something going on there that we could work together to improve. And that is why we moved it from the 311 and to 2022-2023. No, 2022-2023. It was 600 and 859. So Senator Sifuna, even working within what we have, even in terms of healthcare revenue, there has still been significant improvement, even in that sector alone. And that improvement reflects then on the level of service within the facilities. Then coming to the other revenue streams. If you look at land rates, for example, actual revenues in 2022-2023 was 5.9 million, and then actual revenues in 2023-24 was 8.3 million. That is for land rates as an example. If you look at single business permits, in 2022-2023, there were 61,770,000. If you look at 2023-2024, we moved from 61 million to 99 million. And in 2024-2025, we are at 101 million. So we have, because of the revenue administration measures, including the board, we have had improvement, not just in the health revenue, but in all our revenue streams because of the order that has been created.
Governor, you might be looking at a different document because mine is 64 million for 2022-2023 for single business permits.
Yeah, the report that I have here is 61 million. What you have is?
22-23,
Yeah.
64,744,620.
And 23-24?
101.
And this is the only.
We don't have the 90 that you're speaking
I
of.
think your team should
I'm
point
reading
you to
a
the statement
different
of receipts and disbursements under the receiver of revenue statement.
That report.
Because that's the report, that's the basis of the audit report. It bears the numbers that Senator Sifuna is.
And Governor, the reason why I am expressing concern personally, and you see the chair was prodding me to say my other title, I didn't want to say it. But now I have to say it, the SG of ODM, a party that has committed that when we take power, there will be free health care. And the people of Homa Bay will not be paying anything at level 4 hospitals. That will take away 70% of your revenue. That's the concern we are raising. Secondly, Governor, address these landing fees. If in my head I get it correctly, are these beach landing fees for fishermen?
This is beach landing.
Yeah, so it is a bit odd that a county that is known for fishing and its beaches is making less from landing fees than veterinary services.
Yeah, thank you, Chairman. Let me answer the question on healthcare by saying that even the monies that we are raising currently from health, they are not out of pocket expenditure. They are insurance. They are from payments from SHA. They are payments from insurance. Mostly, actually, 95% is payment by insurance to the facilities. So it's not out of pocket. So even when we get to universal health coverage, like we're doing at the moment, these monies continue to come because people don't pay out of pocket, but they're paid, the insurance pays the facilities. NHIF pays, but SHA pays even more now for facilities because the registration is higher. In terms of fish landing, Mr. Chairman, you are a fisherman yourself, and you know that it has been very, very difficult to harness a revenue stream like fish landing because people have been landing over the years for free. So these are streams that we are introducing, and we are working day and night with our beach management units to try and get them to help us to get these fish landing fees. So fish cess and fish landing are streams that have been nearly non-existent, but they are streams that we are harnessing slowly. But you know that with the protests that we had, it has been very, very difficult to introduce, taxes that did not exist well, because people are very, very jittery about paying new monies. But we are discussing constantly. Even when you look at the fish cess, it is some of the things that were very, very low, but we are growing them, and we are growing them slowly. But we have them as streams because we want to grow them. But you can't grow them alone. You can't be at the beaches and everywhere. You have to grow them in partnership with the beach management units. Those processes sometimes do take time. But Chairman, the point I was making is that overall...
Maybe before you lose it, because as you have said, I'm a fisherman, this committee would not be